Here today with Gregory Odland, who is CEO and co-founder of Playback Health. And you did a presentation today with your partner, sort of a fireside chat. What did you want the audience to get from what you guys were talking about?
Yeah, we wanted to really get a live, unfiltered perspective on how technology is changing the way that doctors are behaving at the point of care. What are the tools that allow them to do their job better? So we really wanted to get a perspective from David, who's a neurosurgeon and leads clinical transformation at Northwell Health. He is one of the real thought leaders on this. He's also a world-renowned neurosurgeon. And so his perspective on how technology helps him do his job better is really important. It's a great story. So we love telling it.
Yeah, and it's really bullish too, which is encouraging, I think, to a lot of us who are, we listen to discussions about where health IT is impacting healthcare right now, and there are people who have a lot of good things to say, and there are a lot of people who are trying to sound a lot of warnings about things, and to hear him talk about how technology has left him refreshed and rejuvenated and could possibly extend his career is very encouraging.
David says something that I'd love to hear. He says, Playback has brought joy back to his practice. And when you're a 60-year-old neurosurgeon, to say something like that is really meaningful. Why is that? Because he's able to do things now with technology that he couldn't do before. Communication in healthcare is fraught with emails, texts, live conversations, handwritten. And what technology allows David to do is to have, in the case of one of the features on Playback, which is ambient listening, the ability for AI to hear the conversation, freeing the doctor up from having to input that information into the EMR. I was just with my cardiologist last week, and halfway through the conversation, he says, one second, I just have some documentation to do. Turns his back, stands up, and starts clicking boxes, doing all this other stuff. And so I'm sitting here waiting for it. I love my cardiologist. He's great. But I was thinking about, what he had to do in order to meet the needs of his EMR and what that means to the conversation and the process between he and his patient. It leaves a lot to be desired.
Well, he's talking to you, and he's asking you questions, and he's examining you, and also part of his brain is occupied with, oh wait, I got to write this down, I got to remember all this stuff. So you're not getting the full attention that you deserve.
And it's incredible because I'm thinking I have all these questions to ask, but I don't want to ask the question because he's typing. I don't want him to screw it up.
Right.
And so I have to wait for him to be done. And so he'll stop, he'll look at me, and I'll be like, so what is IVCM? And he'll go, well, he'll have to explain it to me. Whereas when you capture that conversation, he can explain to me, we did an ECG, we found an IVCM, this is what we're talking about. And rather than him only thinking about putting that into the EMR, he can just have that conversation with me. So now I know what's going on, the EMR knows what's going on, and the beauty of the software is I'll get a note from after visit summary based on the things that are important to me in a language I understand, and the EMR will get a note for clinical documentation purposes. The insurance company might get an insurance pre-approval note, for something like that. We'll suggest coding and billing. We can suggest decision insights based on others who have exhibited the same type of diagnosis and characteristics that I've had as a patient. So when you think about where this is going, we're in the first inning of this, right? It's pretty incredible how quick technology is moving. But at the end of the day, what we're trying to solve is improving the conversation between you and your doctor, right? Because I'm going to be more engaged. I'm not going to be thinking about what he's thinking and what questions I have to ask. I can have a conversation and make sure that all of the information is captured. The AI will be able to capture it and template it into useful documentation. And it's a resource in the future for the doctor to go back and remember the conversation they had with their patient. David talked about this quite a bit. The ability to go back and refamiliarize himself with one of the 25 patients he'll see each day to remember what was said and in what context. That's really empowering to a clinician.
The irony here is that you're seeing a cardiologist who clearly could benefit from what you have developed. It might be time to get it into his or her hands right about now.
Well, it's funny because as soon as you ask your doctors, hey, can I record this conversation? They're going to be like, wait, what? But when I was like, hey, we're with Playback Health, you're using our platform. Let me show you what it does. And I just put it down, hit the microphone, and it gives in this case, gives him a note. And he's like, oh my God, his quote, you just saved 20 years off my life. But that's how they think about it. All the documentation, either they do it or they push it to their nurse practitioner or they push it to their PA or someone else. Somebody has the burden of having to hear and record that information. A lot of stuff gets lost. When it goes from here to the keyboard, a lot of stuff gets lost. And that is just the one-to-one between the physician entering the information and the EMR. There's a whole care team that needs to know what happened. So this idea about being able to capture a conversation, one update, updates everybody on the care team, the patient, the family that might be at home, the primary care physician who's not even at the point of care. So when you go to your next office visit and he asks, what did the doctor say? All of that information is presented because one conversation was captured. And that's really, really cool. And that's really empowering.
I would guess the goal is to make this as ubiquitous as possible. But realistically, how do you see you and your company and your ideas moving forward?
I think the people who recognize the value of this are very often the smaller and medium-sized care facilities, right? Big health systems, what do they have? They have real estate. You always have supply of patients, right? That's not an issue for you. Your job is to how do you facilitate that care the best that you can, and how do you manage things like burnout and costs and all of this. For the smaller and medium-sized healthcare facilities that are actively competing for provider networks, competing for patient networks, things like our product are really, really important to them because they can build their brand. It's how they present themselves to their patients. It's how they present themselves to other providers. If I'm a neurosurgeon, I have to get my patients from a neurologist that says you should do surgery. If I'm a physical therapist, I need to get my patients from the neurosurgeon who provided the surgery. But because both of those may not be at the point of care, when you have a platform that you can easily add these people to the platform so everybody knows what the doctor said and what was the care that was provided by the patient, that's revolutionizing. So when we put a platform like this in front of those care practices that are actively competing for patients and for providers and promoting the services and products that they present to those populations, something like Playback is great. It's really, really great. For the purposes of ambient listening, right now this is the hottest area for health systems because they recognize the time savings that they're providing their clinicians. What does that mean for administrators? That means they can see more patients, right? That's a great thing. What does it mean for clinicians? Whatever that time means for you. Does it mean getting home at a reasonable hour so you can have dinner? Does it mean that you don't have to spend the weekends remembering what those patient conversations and then re-entering it into the computer? Like, it means a whole host of different things depending upon whether you're a patient, a family member, a doctor, a corporate administrator. And so these are the types of things when you're trying to bring emerging technology into the big health systems that you have to consider. That's why the sell cycles are much, much longer in healthcare because there's so many different vantage points on what is the ROI of the product that you offer. When you go to the smaller and medium size, they get it right away, right? They associate feature to a value immediately.
Right.
And that is that's a great way when you have product market fit, which we all talk about. Once you have that product market fit and your ability to help your user identify a feature to a value, then you're off to the races, and it's great. In the big health systems, it just takes a lot more work to get there. But when you're in the business of serving patients, the big health systems are where most patients are served.
Yeah. And they'll eventually come around.
They'll eventually,
if they hear enough good word of mouth. So what does it mean for you to be able to present at the HITLAB Innovator Summit and and tell people, and there's some heavy hitters in the audience, hey, this is our system and it works, and here's how it can save you money?
Yeah, I think first of all, I love New York. Our offices are in Long Island City, and we were incorporated in New York. We've been in New York for many years. Northwell Health is one of our large tenant organizations, which is the biggest private health system in New York. So for us, what has been so rewarding is to be able to bring something like this in a city as diverse as New York is, for a health system that is as large as Northwell is, And to be able to go through these periods of time, whether it was COVID, which we learned a ton about, but to bring it all the way through this process, and today being able to use intelligent software like AI and other things for the product that we're doing, it has been an absolutely wonderful ride. We're only in the first inning of this. We will continue to be growing really quickly, which is exciting for us. But it takes conferences like these just to get the word out and let people know that we're there. We're super competitive. We're doing great things for patients and for providers. And our mission is actually to give clinicians more time to care, right? And so when you stick to that mission and you have a sound vision that people are rallying around, it makes it a lot easier to come to conferences like this, tell your story. And these are things that take time, and this is a great opportunity for us to do this. So thank you, Tim. I appreciate it.
Gregory, appreciate you stopping by and sharing your story. I feel better because of it.
Thanks.
Thanks.
Appreciate it.